This is healthcare finance, where every visit is a workflow, every claim is a journey, and every dollar is governed by rules. Today, we're unpacking it all. Less than 1%. That is how many people appeal when their insurance denies a claim. And of those who do appeal, 80% win. Today, I am going to show you exactly how to be in that 80%. When you file a claim, it goes to your insurer for review. They check, is this service covered under your plan? Was prior authorization obtained? Do the billing codes match the diagnosis? If any box is unchecked, automatic denial. You get a letter. One paragraph. Reason, not medically necessary. No further explanation. No phone number that works. That is the system working as designed. Here is what most people don't know. 77% of all claim denials are not about medical judgment. They are paperwork. Wrong code. Missing form. Expired authorization. A date entered incorrectly. Your doctor said you need this treatment. A billing error said you don't. And the insurer let the error win. In 2023, a ProPublica investigation found that Cigna's algorithm processed 300,000 denials. In just 2 months, medical reviewers spent an average of 1.2 seconds reviewing each case. UnitedHealth's AI system, NH-Predict, was later found to have a 90% error rate. 9 of 10 denials it issued were overturned on appeal. The algorithm denied them anyway. A Senate investigation found that UnitedHealth's post-hospital denial rate more than doubled after AI was introduced. This is not a bug. It is the business model. Before your doctor can even treat you, for many procedures, tests, and medications, they need permission from your insurer. This is called prior authorization. The AMA's 2024 survey found that physicians complete 39 prior authorization requests per week, 13 hours of paperwork per doctor per week. 78% of physicians say prior auth leads patients to abandon recommended care. 1 in 4 say it has caused a serious adverse event, including hospitalization, including death. Your insurer is making clinical decisions without a clinical license. 34% of patients who are denied simply give up, not because they got better, because the process exhausted them. The insurer counts on this. Every patient who does not appeal is revenue saved. The appeal window is 180 days. Most people let it close without filing a single page. Here is exactly what to do. Step 1. Read your denial letter in full. The insurer is legally required to give you a specific reason. That reason tells you exactly where to push back. Step 2. Call your doctor's office. Ask them to write a letter of medical necessity, specific to your diagnosis, your history, and this treatment. Generic letters lose. Specific letters win. Step 3. File your internal appeal in writing. Send it certified mail. Keep every tracking number. Reference the denial reason directly and refute it line by line. You have 180 days from the denial date. Do not wait. If your internal appeal is denied, you have one more move. External review. An independent organization, not employed by your insurer, reviews your case and makes a binding decision. The insurer must comply. You have 4 months from your final internal denial to request external review. File on day 1 of that window, not day 119. External review overturn rates vary by state, but in many states, patients win more than half the time. When you call your insurer, and you will need to call, use this framing. Do not say, I think you made a mistake. Say, I am calling to begin the formal internal appeal process. For claim number X, denied on date. I would like the specific clinical criteria used to make this determination, and the name and credentials of the reviewer. Write down everything they say. Get a reference number. Then follow up in writing within 24 hours. Insurers are required to respond to written appeals. Phone calls can disappear. You have rights. A 180-day window to file. An external review if they deny you again. The right to know the clinical criteria they used. The right to a reviewer's credentials. Most people never use any of these. That is why denial rates keep climbing. If this video helped you, share it with someone who has a denial letter sitting on their counter. They have options. They just don't know it yet.